Hello everyone, my name is Mary Powers and it's back to school time for so many little ones this Labor Day weekend or this coming up week. And it's also back to school time for many nurses and that's what I'm here to talk to you today about is why so many RNs are jumping on board with going back to school. With the growing of the magnet recognized hospitals all over the country, the push for more RNs to continue their education, whether it be through BSN or MSN or nurse practitioner, the need is just growing and growing. There are many groups out there, such as the Institute of Medicine, that says that 80% of our nursing field by 2020 will have a higher level education, such as a BSN or MSN. They also are encouraging more certifications, such as CCRN or CEN or Certified Med-Surg Nurses. I have also noticed at my own facility that all the new grads coming out already have their BSN, and honestly, it kind of has made me feel kind of behind times on where I'm at in my career because when I first graduated, it wasn't required, and life happens, you get married and you have kids, and going back to school becomes even more of a challenge. So here I am 11 years later, and I'm trying to get back to school for my BSN. For me and many others out there, it's cost and time and family obligations are big deterrers of why they haven't gone back to school yet. But I know in my own facility, they have increased tuition reimbursement over the years, and it's up to a large amount now that pretty much covers a whole year's worth of classes and tuition. My facility has also started their own school of nursing, which has been huge in my decision to go back to school because they're paying them directly, and it cuts out a lot of the financial part of it for me because I don't have to pay for it out of pocket and wait for a paycheck to be reimbursed 6 months later or 8 months later, or whenever they decide to cut the check. So that was a huge thing for me. As far as my family, now is probably the best time. My son is 6 years old now and pretty self-sufficient. And my husband's at a good place in his career and able to help a lot and really ready for me to go back to school as well. I'm a big encourager of that. So if you have all three of those things covered or even borderline covered, don't wait. Now's the time to jump on the bandwagon and go back to school. The school I chose to take also gives you so much flexibility in how many classes I can take at a time. So I'm considered a part-time student, and that allows me to take just one class or two classes at a time, which is doable for my family and my work life as I'm still working full-time. But if you're not working full-time and you're just trying to do this and get it over with, they also give you the flexibility of going to school full-time and getting your BSN faster. You can take like 3 classes at a time or more. So it's whatever. The possibilities are endless out there now for flexibility and scheduling and how much you want to take at a time. I just suggest you going online, doing your research, and finding out what school works best for you. I know a lot of my coworkers are taking classes through other online programs, and they're only little 5-week classes, and they're able to knock out several classes in a semester. But they just weren't something I was interested in right now. And like I said, with the financial aspect of my hospital and my school of nursing being the same company, it just worked out a lot better for me to have them pay them directly versus me paying for the tuition out of pocket. So those are just all things you have to consider when you get ready to say, hey, I think I'm ready to go back to school, and see which one is best for you and your family. Let's see. Oh, I, like many others of you, are nervous and anxious about going back to school, but again, very excited, and I'm looking forward to the career changes it might bring for me as far as if this goes well, maybe pursuing my MSN or maybe taking on a clin lead role or something higher than just a bedside staff nurse where I'm at right now. And with my BSN, I know that I can climb the professional ladder at work as far as getting more money, or even if you go to another facility, I know you get paid extra for having your BSN, even if it's just $1. And we're all nurses, and nurses love money, so who wouldn't want to go back to school and try to advance their career and advance their financial stability by gaining more money? Let's see. Oh, I feel like I have the hard part down pat, like the clinical aspect of nursing, because I've been doing it 11 years. And I feel like I have that, good to go. I'm training and taking care of precepting others. But, the part that I'm ready to learn more about is like the evidence-based practice and the theories behind why we're doing what we're doing in healthcare, because that's the part that I feel like the BSN courses will bring to me and help me put the whole puzzle together of why they're introducing the VAPs and the CAUTIs and the CLUBSIs, and just the theory part behind it, instead of feeling like they're just making me do it like we all feel. So I hope you consider going back to school, and I hope this has given you some insight into why I'm going back, and maybe give others insight as to why they should go back too. Hope you have a good day. Bye.
Totally.